Welcome to the Deep Dive. Today we're going deep into differentiated thyroid cancer staging.
Yeah.
And I have to admit,
Mm-hmm.
even I was a little intimidated by this stack of research we have
Yeah.
at first, but
That's right.
don't worry.
Yeah.
We'll unpack it together so you can walk away feeling like a staging whiz.
Absolutely.
Yeah.
We're going to break down exactly what differentiated thyroid cancer is,
Right.
why staging is so important, and how it all fits into your journey,
Okay.
from diagnosis to treatment and beyond.
So first things first, what exactly is differentiated thyroid cancer and why does staging matter so much?
Well, differentiated thyroid cancer is the most common type.
Okay.
And the differentiated part means the cancer cells still resemble normal thyroid cells.
Sure.
That's generally good news because it means they tend to grow slower and are often more treatable. But staging is crucial because it helps doctors figure out how far the cancer has spread and how aggressive it might be, which in turn guides decisions about treatment and helps predict your individual chances of recovery.
Okay, so it's like a roadmap
Exactly.
for your entire cancer journey.
It informs everything from the type of surgery you might need
Okay.
to whether you'll need radioactive iodine therapy or how closely you'll need to be monitored after treatment. It also helps doctors estimate the risk of the cancer coming back, which is something I know a lot of people worry about.
Absolutely. So it's about a lot more than just slapping a label on the cancer.
Yeah.
It's about getting a really detailed picture of what's going on.
That's a great way to put it.
Yeah.
And here's something that might surprise you.
Okay.
Staging isn't a one-time deal. It's a dynamic process that can evolve over time as doctors learn more about your specific cancer
Okay.
and how you respond to treatment.
Wait, well, so my stage can actually change?
It can.
Really?
We call this dynamic risk stratification.
Okay.
And we'll dive deeper into that later. But first, let's tackle some of those intimidating sounding staging systems.
Yes, please.
Mm-hmm.
Our sources mentioned AMEs,
Right.
TNM,
Yep.
AGs, MACS.
Yeah.
It's like an alphabet soup of acronyms.
Right.
Where do we even begin?
Let's start by thinking about the big picture.
Okay.
What are we actually trying to achieve with all these different systems? Our sources highlight a few key things.
Okay.
First, staging helps estimate the risk of the cancer coming back
Right.
and the chances of dying from the disease, which is obviously crucial information for you to have.
Right, because if I'm diagnosed, the first thing I'm going to want to know is what are my chances?
Absolutely. Second, staging helps doctors personalize your treatment plan.
Okay.
It's not a one-size-fits-all approach.
Right.
The stage can influence decisions about things like radioactive iodine therapy and how much your thyroid hormone levels need to be suppressed after treatment.
Okay.
Higher stage might mean more aggressive treatment, but it all depends on your individual situation.
Okay, so it's all about getting the right treatment for you.
Yeah.
What else does staging help with?
It also guides the frequency and intensity of your follow-up care,
Okay.
making sure you're getting the appropriate level of monitoring and the right tests at the right time. Plus, these systems ensure that all the healthcare professionals involved in your care are on the same page,
Right.
speaking the same language.
It sounds like staging systems really are the backbone of managing differentiated thyroid cancer.
They really are.
Yeah.
And even though these different systems use slightly different criteria,
Okay.
they all do a pretty good job of predicting how likely someone is to die from the disease.
So even though they might seem confusing at first, they all have their strengths
Yeah,
and ultimately serve the same purpose.
you got it.
Okay.
But there's a catch.
Oh.
They might not be as good at predicting whether the cancer will come back after treatment.
Oh.
One study showed that even when treatment is successful, the initial TNM stage, one of the most commonly used systems, wasn't that great at differentiating who would have a recurrence.
Okay, so it's not just about surviving the cancer. It's also about making sure it doesn't come back.
Yeah.
That's a really important distinction.
Absolutely. And that's why doctors take a holistic approach.
Okay.
They don't just rely on the staging system. They consider all your individual factors, the specific details of your tumor and how you respond to therapy to get a much more personalized picture of your risk.
That makes a lot of sense.
Yeah.
So let's unpack these different staging systems a bit further,
Okay.
starting with that alphabet soup of acronyms.
All right, let's dive in.
Okay.
One of the simpler systems is the AMES system,
Okay.
which basically just divides patients into two groups, low risk and high risk,
Okay.
based on things like age tumor size
Okay.
and whether the cancer has spread beyond the thyroid gland.
So it's a good starting point for
Yeah.
getting a general sense of your risk.
Exactly. Now, the TNM system is one of the most widely used, and you might be surprised to know that it actually considers your age,
Oh.
which is a big deal because younger people tend to have a better prognosis,
Hmm.
even if their tumors have similar characteristics to those in older patients.
That is surprising. I guess age really is just a number,
Right.
except when it comes to cancer.
Yeah.
So what does TNM stand for?
It stands for tumor node metastasis.
Okay.
Basically, it breaks down the cancer spread step by step. The T refers to the size and extent of the primary tumor.
Okay.
The N tells you whether it has spread to nearby lymph nodes.
Right.
And the M indicates whether there are distant metastases,
Okay.
meaning the cancer has spread to other parts of the body.
So it's like a checklist
Exactly.
for how far the cancer has traveled.
And based on these factors, it assigns a stage,
Okay.
typically ranging from stage 1 to stage 4, with higher stages indicating a more advanced cancer.
Okay, that makes sense. But our notes mentioned that the TNM system was updated in 2010.
Yeah.
What changed?
They made the T category a little more precise,
Okay.
subdividing T1 tumors into T1A for smaller tumors and T1B for slightly larger ones.
Okay.
They also added a category for multifocal tumors,
Okay.
which means there are multiple cancerous spots within the thyroid.
So they're essentially getting more granular with the details.
Right, they wanted to make sure they were capturing all the nuances of the tumor itself.
Okay.
Now, besides TNM and AMES, there are a couple of other systems we should touch on.
Okay.
We have AGES and MACI,
Okay.
which use similar factors like age, tumor size, and spread,
Mm-hmm.
but combine them in slightly different ways.
Do they offer any advantages over the TNM system?
Well, MACIS, for instance, tries to be a bit more objective
That's
by
right.
avoiding the need for a pathologist to grade the tumor's aggressiveness under a microscope,
Right.
which can sometimes be a little subjective.
Okay.
But all of these systems are just different tools for trying to understand the cancer's behavior.
I'm certain to see that each system has its own quirks and emphasis.
Exactly. Now, I know this is a lot of information.
Yeah.
So let's take a moment to recap.
Okay.
We've got the AMS system, which is the simplest, and the TNM system, which is one of the most commonly used.
And don't forget AGES and MACIs, which offer slightly different approaches to evaluating those same key factors.
That's right. But there are actually a few more staging systems out there, but we'll save those for later.
Okay,
Or
that's
not.
good.
Mm-hmm.
Okay, so we've explored a few of the main staging systems used for estimating mortality risk in differentiated thyroid cancer.
Yeah, we've covered TNM, AGES, and MACIS, each with its own unique approach to combining factors like age, tumor size, and spread.
And it's clear that no single system is perfect, but they all contribute to our understanding of the cancer's behavior.
Exactly. But remember, there's another crucial piece of the puzzle we need to discuss.
So,
Predicting the risk of recurrence, that's where the ATA risk stratification system comes in.
yes. This one was specifically designed with recurrence in mind, wasn't it?
It was.
It seems like doctors really want to get a handle on that risk.
Absolutely. And it's actually a bit simpler than some of the others we've talked about.
Right.
It categorizes patients into 3 risk groups:
Okay.
low, intermediate, and high, based on several key factors.
So what kinds of factors are we talking about here?
Well, it takes into account things like your age, the size of the tumor, whether it is spread to nearby lymph nodes or beyond, and certain aggressive features of the cancer cells themselves.
So it's kind of like a checklist of red flags that might increase the chance of the cancer coming back.
Precisely, and the research we have here really supports its effectiveness.
Okay.
A study at Memorial Sloan Kettering Cancer Center found that the ATA risk stratification system was incredibly accurate at predicting who would have a recurrence or persistent disease.
Okay. I'm definitely interested in hearing those numbers. How effective was it?
They found that only about 3% of patients in the low-risk group had a recurrence or persistent disease.
Wow, that's incredibly low.
It is, but that number jumped to 21% for the intermediate risk group,
Okay.
and a significant 68% for the high-risk group.
Those are some pretty big differences. It really shows how important this risk stratification is.
It absolutely does. And it's not just about predicting who might have a recurrence.
Yeah.
It also helps guide treatment decisions.
Okay.
For example, patients in the higher risk groups might be recommended for more aggressive therapies or more intensive follow-up.
So it's all about tailoring the approach to each person's individual risk.
Exactly. But here's where things get even more interesting.
Okay.
The ATA risk stratification system isn't just a one-time assessment.
Wait, what do you mean? I thought once you were assigned a stage, it was pretty much set in stone.
That's a common misconception. It's actually much more dynamic than that. Your initial risk estimate can actually change over time based on how you respond to treatment.
Hold on, you're telling me my risk category can actually shift? That's a game changer.
It absolutely can. It's called dynamic risk stratification.
Yeah.
And it's a relatively new way of thinking about staging in differentiated thyroid cancer.
Okay.
It recognizes that your journey isn't static and things can change over time.
Okay, I'm all ears. How does this dynamic risk stratification work in practice?
Well, think of the initial staging as a starting point. It gives doctors an idea of your risk based on what they know about your cancer at diagnosis.
But as you go through treatment and follow-up, they gather more information, and that initial assessment can change.
Exactly. They're looking at things like your thyroglobulin levels,
Okay.
which is a protein produced by thyroid cells.
hmm
If those levels are low after treatment, it's a good sign that there's less thyroid tissue cancerous or otherwise hanging around.
So they're using blood tests to monitor how well the treatment is working.
Right. And they also use imaging scans to check for any signs of the cancer returning, so they're constantly monitoring for any potential issues and gathering data to refine your risk assessment.
So someone who was initially classified as high risk could actually move into a lower risk category if they have a great response to treatment.
Absolutely. And on the flip side, someone initially classified as low risk might need to be bumped up to a higher risk category if they have certain concerning findings during follow-up.
Wow, this dynamic risk stratification really changes the whole staging landscape.
It does. It acknowledges that staging isn't a one-time event, but an ongoing process of assessment and refinement. It's about staying vigilant and responsive to the individual's journey.
Okay, so we've got these various staging systems like AMES and TNM that help estimate mortality risk, and the ATA risk stratification system that focuses specifically on recurrence risk.
Yeah.
And on top of all that, we have dynamic risk stratification, which allows those risk estimates to change over time. It's a lot to take in. No wonder people feel overwhelmed by thyroid cancer staging.
It's definitely a complex landscape, but remember, knowledge is power.
Right.
The more you understand about these systems and how they work, the better equipped you'll be to have informed conversations with your doctors and make decisions about your care.
You're absolutely right. It's about becoming an active participant in your own health journey rather than just passively accepting information.
Exactly. Now, before we move on from staging systems, there are a couple of key takeaways I want to emphasize.
All right, I'm ready for those pearls of wisdom.
First, remember that all these systems are based on data from large groups of patients. They provide valuable insights into overall trends and probabilities.
Okay.
But they can't predict with 100% certainty what will happen in any individual case.
So there's statistical tools, not crystal balls. That's an important distinction to keep in mind.
Absolutely. And second, staging is just one piece of the puzzle. Doctors also consider a whole host of other factors when assessing your individual risk and making treatment recommendations.
Like what kinds of factors? This is where it gets really interesting, right?
It does. Our source material delves into some of these other prognostic factors, and it's pretty fascinating stuff.
Okay, I'm definitely intrigued. Let's dive into those other factors.
All right, let's start with something called lymphocytic infiltration. Have you ever heard of that?
It rings a bell, but I can't quite recall what it means.
No worries. It basically refers to the presence of certain immune cells called lymphocytes within the thyroid gland. And what's interesting is that having lymphocytic infiltration seems to be a good thing.
Immune cells in my thyroid are a good thing. How so?
Well, studies have shown that people with differentiated thyroid cancer who also have lymphocytic infiltration tend to have lower rates of recurrence and even lower mortality rates.
So it's like their own immune system is giving them an extra boost in fighting the cancer. That's pretty amazing.
It really is. It suggests that a robust immune response within the thyroid gland might help keep the cancer in check. It's just one example of how complex and fascinating thyroid cancer can be.
I had no idea. Something as seemingly simple as lymphocytic infiltration could have such a big impact.
It's a reminder that there's always more to learn. But let's move on to another interesting prognostic factor.
Okay.
PEAT-positive tumors, you've probably heard of. PE scans, those imaging tests that can detect cancer activity.
Yes, they're the ones that light up when there's something suspicious going on, right?
Exactly. And in some cases, differentiated thyroid cancers are first detected on PD scans. These PD-positive tumors tend to be more aggressive and unfortunately have a worse prognosis than those that aren't detected this way.
So that's definitely something doctors take note of when assessing a patient's risk.
Absolutely. Now let's talk about histologic subtypes of differentiated thyroid cancer. Remember how histologic refers to what the cancer cells look like under a microscope?
Right. We touched on that earlier, but you're saying there are different variations even within those subtypes.
Exactly. There are different subtypes of differentiated thyroid cancer, like papillary thyroid cancer and follicular thyroid cancer. And even within those subtypes, there can be variations that affect your prognosis. For example, within papillary thyroid cancer, there's a tall cell variant, which tends to be more aggressive.
So even though they're all considered differentiated, the specific type can make a difference in how the cancer behaves.
You got it. And then there are poorly differentiated thyroid cancers, which fall somewhere between the well-differentiated ones we've been talking about and anaplastic thyroid cancer, which is much more aggressive and difficult to treat.
Wow, so there's a whole spectrum of aggressiveness even within differentiated thyroid cancer.
Exactly. And we can't forget about the exciting world of molecular characteristics, which is a rapidly evolving field. This involves looking at the specific genes and mutations that drive the development and behavior of different cancers.
So it's getting down to the genetic level to understand what makes each cancer tick.
Precisely. Scientists are learning more and more about these molecular characteristics, and in the future will likely be able to use molecular profiling to predict how a thyroid cancer might behave and personalize treatment even further.
That sounds like the future of cancer care treatments tailored to each person's unique genetic makeup.
It's incredibly promising, and it highlights how much we're still learning about thyroid cancer and how to treat it most effectively.
It's definitely a lot to take in, but I appreciate getting this overview of all the different factors that contribute to an individual's prognosis in differentiated thyroid cancer.
It's important to remember that it's not just about the stage, it's about these other characteristics, how you respond to treatment, and a lot of ongoing assessment and monitoring.
You've painted a really clear picture of how complex and individualized this journey can be.
It truly is. But I think it's time we shift gears and talk about what all this means for you, the listener.
Okay.
How can you use this information to be proactive and advocate for yourself?
That's a great question.
Yeah.
I think we're ready for some practical takeaways.
I agree. Let's distill everything down to some actionable advice that you can use on your own journey.
So how can we use all this information about staging
To
be proactive and advocate for ourselves?
That's a great point. Let's distill everything down to some key takeaways that you can actually use.
Okay.
First and foremost, remember that staging is not about getting hung up on a number. It's a tool to help doctors understand your individual risk
Right.
and tailor your treatment accordingly.
So it's not about freaking out over a specific stage, but rather about using that information to guide decision-making.
Exactly. And remember, staging isn't static.
Right.
It's an ongoing process, especially with that dynamic risk stratification we talked about. Your risk category can actually change over time based on how you respond to treatment and other factors.
Yeah, it's almost like staging is more of a verb than a noun,
Yeah.
right?
It's an active, evolving process.
And here's another crucial piece of advice. Don't be afraid to ask your doctor questions about your staging and what it means for you.
Absolutely.
It's your health, and you have every right to understand the ins and outs of your diagnosis and treatment plan.
Couldn't agree more. It's about being an active participant in your care, not just a passive recipient of information.
Right, and not comparing yourself to others.
Oh, that's so important.
Because everybody's different.
Everybody's different. What works for one person might not work for another.
Right. And just because you know somebody who had, stage whatever, and they had this treatment and they were fine, doesn't mean that that's going to be you.
Right. Your case is unique.
Yeah, so just really advocate for yourself. And I guess that goes back to knowledge is power.
It does.
The more you know.
The more you know, the better you can advocate for yourself.
Yeah. And knowing your stage is just the beginning.
It is. How are you going to use that information to shape your journey?
Right. And don't forget, there are tons of resources out there.
There are.
Like the American Thyroid Association and THYCA.
Yes.
The Thyroid Cancer Survivors Association.
Yes. Great resources.
That can provide a community for you and support.
That's so important. You're not alone in this.
Exactly.
There's a whole community out there to support you.
Well, I think that about wraps it up for this deep dive.
I think so too.
Thank you so much for joining us today. We hope this exploration of differentiated thyroid cancer staging has left you feeling more informed and empowered.
Absolutely.
Until next time, keep diving deep.